Okay, well, good morning, everyone. Thank you for joining. It looks like we have a nice turnout already this morning. We have a couple of guests on our call today. I want to start out by introducing our County Health Department Director, Larry Johnson. I've told some of you, I think I might have even mentioned on the call last week, it really is the number one question we're getting from our stakeholders right now is what is the availability of the vaccine? I'm getting communications almost daily on that. So I think you can tell by our email communications, by these calls, we are making that top priority to keep you informed. And I just want to reiterate how grateful we are to have a great collaboration both with Memorial Healthcare and our county health department. I don't see that necessarily with the economic development agencies in other counties, that same kind of collaboration. So I'm very, very grateful for it. And we're going to do our best to keep you informed about what's going on with that. So last week we had Tom Kurtz on from Memorial, and he gave a good update from Memorial's perspective. And today we're going to have Larry give us an update from the county health department perspective. So Larry, the floor is yours.
Okay, thanks a lot, Justin. Can you hear me?
Yep, you're good.
Okay. Thanks for having me again. I really appreciate it. It's becoming kind of a tradition here. So just a quick update on where we're at. Last week we reported out 3,429 confirmed cases. And that was up 67 from the prior week. We're going to be reporting out more numbers tomorrow, but I just wanted to reiterate a positive trend that we're seeing. Last week's case numbers, week over week, being 67, were the lowest since October 21st. And this week, I don't have the numbers yet. We're working on it, but I'm continuing to see the trend. We think we're going to have another number that's in that range. So that's good. That's good news. Regarding the vaccines, that's the number one thing that people are asking and reaching out to us. So as of last week, we had received 2,000 doses, both first and second dose vaccine. All first doses have been pushed out and have been administered, and that was 1,600 out of that 2,000. And out of the 400 second doses, we have about 18 remaining to complete this week, and then those will all have been administered. For this week's supply, we have received 500 doses, first dose, and we will be administering all 500 this week. We are turning around our first doses within the 7-day recommendation that the state recommends. We're actually doing it within 5 days. So that's good. And as far as who we have been vaccinating, we have finished our frontline health individuals and our EMS, first responders, police, and fire. If there are any that are still remaining, we will fit them into our upcoming clinics. We also have completed our school staff, which is a huge one that we had talked about a couple weeks ago. And that's so key, so important to keeping our schools open. We have also started the 65 and up group, and that is our largest group right now that we have that's outstanding. We have a waiting list of over 4,000 people, and even though we've been cutting into it a little bit, we're still getting more and more people that are signing up on our list. So with that list, we are calling the individuals that are on that list to schedule an appointment. And if they are not available when we call, we are giving them a number that they can call back, and we will fit them in. So we don't want people to feel like they got to wait by the phone. They're going to miss their call. Getting that question quite a bit. We're randomizing the list. We've gotten that question quite a bit. Well, I got on January 10th, and why can someone get on February 10th? And a month later, and that's just not fair. Well, the fairest way to do it was to randomize it. So we're randomizing it after each clinic. So when we do the calls, it's been randomized. And really, the reasoning we had behind that was many people didn't even know we had a list back in January. So we just went with the randomization, fairest way to do it. We are partnering right now with Kroger to assist us in the 65 and up category. We also had some volunteer staff help us from Memorial Healthcare, some nursing staff, and so that was really nice. And we are communicating with the local pharmacies because they are going to be receiving vaccine direct shipment. We do not know when that will be, but when it does happen, it's going to help with our supply and demand issue. So once the pharmacies come online, that's really going to help us. And Kroger is willing to work with us on our 65 and older list. So hopefully there'll come a time here where you'll be able to get the COVID vaccine at a pharmacy. We're still not getting enough doses. I mean, you've heard it. You probably heard it from Memorial. It's a statewide problem. I've reached out to the governor's office. I've reached out to my counterparts of the state. What the state has done is develop what they call a social vulnerability index. It's somewhat complicated for me to try to explain, but I'm going to send Justin a link that kind of explains it in better detail. And it really looks at a lot of factors in your community, some of which are like poverty, English speaking, those sorts of things. And so they came up with this index, and that is how they're distributing the first dose vaccine. We can no longer order it like we were able to do the first couple weeks. It's all basically an established allotment that we get, and we don't know what we're going to get for the following week until the Friday before. That's when we've been finding out. And then we've actually been scheduling. We've been working through weekends scheduling people. It's a difficult lift to try to get just say 500 people scheduled because every phone call is a life story. And so we're trying to get through that, get the script, stick to the script. We've brought in volunteers to assist us with making these calls, so that also has been helpful. But I wish I could tell you that we're going to get to these businesses and other entities which we've surveyed your folks sooner, but we're just not there yet. We've got to get through these 65 and older. You know, they're the highest risk, and so we're going to continue to get through them. And I think as more vaccine comes online, we're looking at possibly March for the Johnson & Johnson vaccine to come online, and that will help with the supply chain if we get a third vaccine coming into the market. And if that increases our weekly dose allotment, then we're obviously going to be pushing it out because we have the capacity to administer more than what we're doing right now. And we're prepared for that. So I wish I could tell you some better news on when we're going to get to your particular business. I get the calls every day. Hey, I feel like I'm a frontliner, you know, so on and so forth. But the bottom line is we've got to get through these 65 plus age group, and then we'll be working with more entities. So with that, Justin, I'm going to turn it back over to you. And if you have any questions, I'll take a couple really quick ones, and then I got to get off.
Great. Thank you, Larry. Once again, I think you might be our number one participant. If I had up all of our guest participants over the last 10 or 11 months. Once again, I can't thank you enough. Two things. One, to confirm something. You had mentioned the last time you were on a couple weeks ago, the best thing to do is get yourself on any list you can. Is that still the case?
Yes, that's correct.
Okay. The other thing I'm wondering, and knowing that they're not ready yet, are you still open, particularly for some of our larger employers, when you have the doses, are you still open to coming on site to their place of business to distribute the vaccine?
We are open to that. It's going to depend on how many individuals we can get at the site. Many of the businesses may only have, like, say, 20 to 50 people. And if that becomes the case, we're probably going to do a central location where we would bring in like maybe 4 or 5 of those businesses so we could administer like 300 to 400 shots in one location. But we're not opposed to coming out if we can do enough doses. We just have to make it, worth our time per site. You know what I mean?
Yep. Good. I got that question from a few people in the last week, and I figured there'd have to be a critical mass for it to make economic sense and time sense. I want to open the floor right now. Does anyone have any comments or questions for Larry? Please hit *6 on your phone, please. Anyone have any comments or questions?
Yeah, Justin.
Go ahead.
Justin, this is Brian Long with Memorial Healthcare.
Hey, Brian. Good morning. Thanks for joining.
Yeah, you bet. So this is not so much a question for Larry, but I guess more a question with regard to the gentleman that I heard that had made some comments for Governor Whitner's office, and Larry addressed some of those issues, and I just wanted to address some of these things. I think what's most important is to understand that the one primary issue that we're dealing with right now is lack of availability of vaccine. And there's an interesting comment that was made by this Gary Jones that said, you know, we're happy to see our continued ramping up or promising action from the Biden administration, ramping up the vaccine availability. Well, that's not coming to fruition really in Shiawassee County. And it's not really been much of an issue with Michigan as well. In fact, some of this is nationwide, some of it is statewide. But, you know, we've seen a lot of actions taken with regard to distribution network. That's not an issue. Whether it's the pharmacies, Kroger's, the county health departments, the hospitals, the distribution network is there. The issue that we need to focus on right now is getting the product, and we're not getting it. Memorial got 100 doses the last 2 weeks. That's a joke. But we can't really do anything without the product. And I guess the question I would have, if you're getting any information back from the governor, because we're not hearing, as Larry said, we hear a couple of days before the week that this stuff is going to roll out, how much we're going to get for the next week. But there was a strategic plan, interestingly enough, rolled out on January 29th, over a month after we started this process. So it's kind of interesting in that we've gone a month and we finally decide, well, maybe we need to have a plan to do this. But in there, a couple of the bullet points said that the communication from the state was going to be, frankly, timely, transparent, and accurate. And it's almost been non-existent, misleading, and ambiguous. That being said, hopefully that improves. It hasn't thus far. So if we can get the product, we can get it distributed. Right now, we're not getting the product, and the efforts haven't proven at all more promising in any way that we've seen it. In fact, it's continued to diminish. Now, we do have some hope with the Johnson & Johnson product, and we hope that production picks up on the Pfizer and the Moderna. But thus far, we haven't seen any additional distribution efforts that have been successful in the state. We're talking about, like I said, increasing the distribution sources, but those sources are dry as far as product for the most part. Larry's right. There's areas that we have to focus on, and I think that's been done effectively. But we need product to be able to distribute, and I would like to get answers from the state when that's likely to occur. And of course, they can't produce the product. If it's not available, they can't get it out. But I think we need a little bit more honesty and accuracy about what we're actually able to expect in the coming weeks and months. We're just not getting that information, Justin.
Thank you, Brian. I appreciate your candor on this, and absolutely understand. I don't know, Larry, if you have any comments you want to add to that, or I want to keep the floor open too. If anyone else has any comments or questions, please hit *6 on your phone to unmute yourself. Anybody want to add anything to that? Okay, do a last call. I just want to make sure everyone has a chance. And once again, I do want to reiterate our thankfulness that we have in a great partnership with our friends at Memorial, with our friends at the health department for what they're doing, and absolutely understand the concern that capacity, availability of the vaccine is the issue. That our folks, Memorial, the health department, are ready to go. We just need the product. And actually, one last call. If anyone has anything, *6. Okay. And we'll have a moment later too. If anyone has anything else, please let us know. But actually, that's a pretty good lead in because I believe we do have Gary Jones on. Gary, do you want to jump on now, and do you want to make any comments in regards to that?
Oh, hey, Justin. Good morning. So I'll start with the data first and get into the announcement. So total confirmed cases for COVID-19 statewide are now 569,417. Total COVID-19 related deaths are 14,905. And number of COVID vaccine doses administered statewide are now 1,292,572. So recently, Michigan's health insurers extended agreements to provide coronavirus testing and treatment at no cost to patients. So the governor and the Michigan Department of Insurance and Financial Services announced that the state has secured agreements from nearly all of the state's health insurers to extend their commitments to waive all out-of-pocket costs for COVID-19 testing, vaccinations, and treatments. Also recently, the governor signed an executive order to create the Student Recovery Advisory Council of Michigan. So as Michigan continues to work around the clock to eliminate COVID-19, the Student Recovery Council will provide guidance and recommendations to ensure Michigan students have the tools and resources they need to get back on track. Also recently, MDHHS updated its current epidemic order to allow contact sports to resume as of Monday, February 8th. Provided masks are worn during practices and competition. Safety protocols like wearing masks and testing will help kids, coaches, and families remain safe and allow our schools to remain open for in-person instruction. Also recently, the governor applauded the Biden administration bold actions to increase vaccine supply and expand FEMA reimbursements to states. So the Biden administration announced additional steps to increase the vaccine supply to states to 10.5 million doses nationwide and provide reimbursement to states for actions to combat COVID-19. The governor has been vocal in calling for additional support from the federal government to provide additional support for the Michigan National Guard to continue assisting response efforts throughout the COVID-19 pandemic. Also, Governor Whitmer recently joined with Republican and Democratic legislators to announce the launch of the $30 million Michigan Reconnect program, the largest effort in state history to ensure that more than 4.1 million Michiganders who are 25 or older and do not have a college degree will have an opportunity to earn a tuition-free associate degree or skill certificate. Michigan Reconnect will pay the cost of tuition for eligible adults who want to pursue an associate degree or skill certificate at their in-district community college. Also recently, Dr. Janae Caldoun, or Dr. J, stresses need for more vaccine and focus on equity in testimony to Congress. Dr. Janae Caldoun, the Chief Medical Executive and Chief Deputy for Health at the Michigan Department of Health and Human Services, testified before the House Energy and Commerce Oversight and Investigation Subcommittee about Michigan's COVID-19 vaccination efforts, federal needs, and the state's work to expedite the administration of vaccine without compromising equity. Approximately 810,000 Michigan children whose access to nutritional school meals has been affected by the COVID-19 pandemic will receive $741 million in assistance benefits that their families can use to pay for food at stores or online. Governor Whitmer and the Michigan Department of Health and Human Services are announcing that the state has gained federal approval for a second round of pandemic EBT benefits. Payments will be paid automatically, so families do not need to apply to receive the assistance. And also, or lastly, I should say, today at 1:30 p.m., Governor Whitmer and Chief Medical Executive Dr. Janae Caldoun will provide an update regarding COVID-19 and the continued efforts to slow the spread of the virus. So you can catch that on Governor Whitmer's Twitter feed or on her Facebook page. And also, I do believe it's usually carried by local media too as well. And lastly, before I open it up for any questions, Michigan.gov/COVID vaccine and Michigan.gov/coronavirus are both the best catch-all websites for either the vaccine or COVID-19 in the state of Michigan.
Thank you, Gary. So obviously, you heard from our health department director, you heard from the CEO of Memorial about their concerns. Can you give as good an answer as you can to that, to those concerns?
Yep. And so it was actually addressed inside of my remarks. So our chief medical executive recently testified before Congress in regards to Michigan's COVID-19 vaccination efforts, the federal needs, so that, the things that we need essentially as a state, and the state's work to expedite the administration of vaccines. And so it was that piece that spoke to that question. And then also too as well, you heard the announcement about the additional steps from the Biden administration to increase supply to states to 10.5 million doses nationwide, but also provide reimbursements to states for actions to combat COVID-19 as well. In addition, the support that we've been receiving from the federal government that Governor Whitmer has been so vocal about to provide the National Guard or continued utilization of the National Guard assistance. And then also too as well, one thing that I mentioned last week, but it wasn't in my comments this week, was we also need the legislature to pass the My COVID Recovery Plan. Inside of the My COVID Recovery Plan actually is funding related directly to vaccine distribution. And so that is going to be essential, especially, as the Biden administration has been, focused on ramping up. I know that was, the language, that was quoted earlier actually in regards to ramping up. And yes, it's an issue in Michigan. I've heard it, from several counties, but also it's a nationwide issue too as well, because states do receive their supplies from the federal government. But we do have a plan in place, I should say, in regards to vaccine distribution in the state of Michigan, but we just need the legislature to act.
I'm going to open it up. Anyone have any comments or questions for Gary? Hit *6 on your phone.
Hi, Larry. This is Lena Miller, Shiawassee RESD. And I was wondering where we could find more information on the Michigan Reconnect program, and if you could speak to how that's going to work for a county that doesn't have a community college, if there's any difference, if they can still use the benefit, maybe address some of those things.
Yeah, sure thing, Lena. Yep, I can get some more information from you there and find out about that, the piece in regards to counties that do not have a community college as well. So if you could actually send an email to Justin, and then I can follow up with you that way.
All right, sounds great, Larry. Thank you.
Thanks, Lena. Other comments or questions for Gary? Anybody have anything? Hit *6 on your phone, please. Anyone have anything? Okay, well, Gary, Larry, Brian, thank you all, obviously, for your comments. Did I hear somebody?
Hi, Justin, this is Janet Kiley. I live in Shiawassee County. It's my first time on the call.
Oh, yeah, go ahead, Janet.
I just wanted to ask Gary if he would please carry a message back to the governor that, based on what I'm hearing from Brian and from Larry, that the local infrastructure is doing great. All we need is product. Just send us product. The reason I'm saying that is that I hear from my friends, and I have friends all over the state, and they're saying the same thing, that they're organized, they're ready. But what you hear out there is that nobody's organized and nobody knows what they're doing. And I think that really the governor needs to make clear to the people of Michigan that we at the local level are ready, we're doing great, and we're just waiting for product.
Yep, and I can echo that too, and that's essentially the comments that our Chief Medical Executive, Dr. Janae Calhoun, actually spoke to Congress too as well, as far as the need of Michiganders here in regards to the vaccine. So on that front, yep, we raised that directly to the source where the vaccine comes from, and it comes from the federal government. But again, it's not a Shiawassee specific issue. Even my home county, Genesee County, I mean, we have 40,000 people here in Genesee County that's on our wait list. And so just, to give an idea, just, your neighboring county over, in terms of what the needs look like, it's a statewide issue. It's a nationwide issue.
Thank you.
Thank you for your comment. Anybody else have anything? If you do, hit *6 on your phone, please. Any other comments or questions for Gary? Okay, well, this is going to be, did I hear somebody? Okay, can't tell sometimes. This is obviously going to be a running issue, Gary. We're going to keep this front and center because I think we all know it's critical for us to recover and to get back to a sense of normalcy in this country. We've got to get the product out there. And once again, I think it's been well stated today that our community is ready. Shiawassee County is ready through our hospital, through our health department. We just need the product. So anything you can do, either at a state level or federal level, to get more product into this county, we would certainly appreciate it. Mentioning federal, my intent, you guys are probably all following the stimulus discussion in Washington right now. It's obviously high priority there. A lot of debate over what that package is going to look like, but we are monitoring it. And our intent here is once things get closer to being finalized, we will probably have our congressmen and senators back on again to give an update on what that all means for Shiawassee County stakeholders. So I just want you to know that we continue to monitor that, and we'll probably have an update here in the coming weeks. Not next week, but the following week, we're going to have another familiar voice, Nancy Chinonis. Many of you remember Nancy. She's been a great labor law and employment expert for us over the last 10 months on questions related to the pandemic and employment issues. And I've gotten a few in recent weeks regarding COVID-19 pay and a few other things. So she's going to come on here in 2 weeks to give an update on what's going on with labor law issues. And as always, if any of you want speakers that we don't have, please let us know. We will absolutely make sure to let you know. A couple of event-related items I wanted to bring up. Brent, do you want to jump on and talk about our e-commerce event coming up in a couple of weeks? It's starting to come together.
Can you hear me?
Yep, you're good. Yep, you're good.
I was having a little delay there. Yep, so we are reconvening the e-commerce group that we partner with the Shiawassee Regional Chamber of Commerce on for an event on product photography practices. That will be with Michael Jordan of David Lorne Photographic in Owasso. He's just a wealth of knowledge on the subject, and we're glad he was willing to take the lead on this event with us. That'll be February 25th at 11 a.m., and the registration should be opening later this week, so keep an eye on your emails for that.
Thanks, Brent. I actually just confirmed via note here that we do have a sponsor for that. It'll be Davis Cartage. They sponsor the last one, so Davis Cartage, the local trucking and warehousing firm, will be sponsoring that. Another item I wanted to bring up or reiterate, some of you were on our call last week with USDA Rural Development. We had a really good turnout for that webinar. I think it was about 25 people. And I sent out a follow-up email. Hopefully you got it. There are a lot of programs for business, for nonprofits, for local governments that are available through USDA Rural Development. And depending on what your situation is in your organization, definitely worth exploring. So that was last week on an event, but if you want more information, if you want to connect with them, please definitely let us know. The last thing I want to offer, because I just got a testimonial on this the other day, talent. We continue to promote talent. You all know we have a jobs board. If you're an SEDP investor, you're very welcome to post your jobs. It's on our website. But I got a testimonial from a business, and I wanted to offer this to all the employers on the call that need talent. We have a very robust network of education partners, workforce development partners, media partners, who are very interested in strengthening their engagements with employers to try to provide more resources to get the word out about your job openings. And so what I'd like to offer for those employers that are hiring, we do a Teams call like this where we invite that network to come and meet with a company. And so we've done this a couple of times, usually get about 12 to 15 folks. And I just got a testimonial from one of our businesses that through that connection, they were able to hire 20 people because we brought so many new potential partners in those areas in media, workforce development, and whatnot. So I'd like to offer that. If any company on the phone, if you're hiring, it's a pain point for you, you're struggling to get workers, you're trying to find new ways to find people, please let me know. We'd be happy to make some of those introductions for you. So I just want to note that because that is certainly continuing to be a top issue for our companies is finding work. So anyway, with that, that's all I have today. Once again, if you're looking for new speakers or have ideas, please let us know. We'll stay in touch as we get more updates on vaccines, obviously. And that's it for today. So thank you all for joining. And as always, if you need anything in the meantime, give us a holler. Have a good day, everybody.